Quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to another episode of the PEMF podcast.
And today we're going to be talking about PEMF and osteoporosis, which is quite a common use for PEMF. We're explaining how PEMF can actually help osteoporosis. We're looking into some studies and a lot more kind of stuff. So for anyone, this might be their first episode. What is PEMF, just in a nutshell?
So PEMF therapy, in as simple form as it can be, is basically pulsed electromagnetic fields. So we're using magnetic fields to influence the body's cells, and that in turn will create the ultimate environment within the body to heal. How
can then PEMF then help these people with osteoporosis?
We'll start by talking about how it can stimulate the bone formation. So the PEMF therapy can actually encourage the activity of the osteoclasts that we've mentioned before in another podcast. And that's promoting the formation of new bone tissue and helping to maintain a healthy bone density. So on top of that, you've also got improving blood flow. So obviously, if you can improve circulation to the area, you can deliver essential nutrients. In specific, I would mention the calcium ions to those bones. And that's going to help support overall bone health and those repairs. And then we mentioned reducing inflammation quite a lot on the podcast. And again, PEMF therapy is just amazing for reducing inflammation. So if we can reduce the inflammation to that area, it kind of help affect the bone health and contribute to the osteoporosis within that as well.
Okay, yeah. And that podcast that you mentioned was PEMF and non-union bone fractures. It will be on our channels if you want to go listen to that one. But are there any kind of studies related to osteoporosis and PEMF?
Yes, there are actually many studies linked to PEMF and osteoporosis, because it goes all the way back as far as NASA and their studies when it came to bone density and their astronauts. So NASA was really where PEMF kind of got commercialized, and the studies that they did looking at their astronauts going up in space, coming back down again, and trying to regulate their bone density because they were taken away from the Earth's natural magnetic field. So we actually looked into this and found a really interesting study among, as I say, many of them. And this study compared PEMF with a common medication for osteoporosis called alendronate. And this is used to either stop osteoporosis in its tracks or try and reverse the effects of osteoporosis. This study was done in China with 44 women who actually had postmenopausal osteoporosis. They were given either alendronate or PEMF therapy, and the goal was to see how the two different treatments affected the bone density in the spine and the hip, as well as vitamin D levels and muscle strength and balance. And what they found was that after 24 weeks, there was no significant difference between the two groups, showing that PEMF was just as effective as a commonly used medication called alendronate. So it turned out to be a very effective form of treatment for osteoporosis, and we see lots of customers that are using PEMF therapy for osteoporosis with great effect.
No, definitely. And if you want to find that study and many others, go check out our Instagram. There's loads on there. I'm always uploading PEMF studies and just loads of other PEMF related content. Have you got any kind of just examples for anyone you might have known who had osteoporosis and used PEMF, just to kind of put it in their head how it might kind of work as such?
Yeah, so there's loads. We get customers all the time using PEMF for osteoporosis. It seems to be one of our kind of most popular modalities to use PEMF therapy for, but one really sticks in my mind actually, and this was actually one of my very first customers back like 10 years ago. Her name was Pat, and she bought a super low intensity PEMF device because that's kind of like all we offered at the time. And she had quite severe osteoporosis, and she was getting quite a lot of pain in her joints from her since her diagnosis. And every year she got a scan, and her bone density was kind of like deteriorating quite rapidly. So she bought a system from us, a full body system, and she was using it on a daily basis. And her first year scan was a bit of a turning point for her, because she didn't actually see any results in terms of the osteoporosis reversing, but she actually saw that the osteoporosis had stopped in its tracks, which for her was a massive turnaround. She then committed to it, and she had another year scan. So on a second year scan, the osteoporosis was actually reducing. So it was amazing kind of like story for me to kind of experienced the benefits of PEMF therapy. And as I say, this was one of my first customers, and she kind of reaches out to us every now and then, just saying how she's gone on. And this is like 10 years ago now. And, she's on a much reduced pain now. So amazing results.
No, it's a good story. And it once again kind of highlights that it is a longer term kind of therapy, and it's not going to fix itself overnight, like you said, or in a week. You're not going to have a scan and have another scan and see a massive improvement. It is something you're going to have to do for a longer period of time. But if you do commit to it, you do get to that end result. But for anyone who might not actually have osteoporosis or any kind of bone disease, is there still benefit to using PEMF for bone health?
Yeah, so PEMF therapy can be used for just kind of preventative maintenance when it comes to osteoporosis and just bone health in general. Regular PEMF therapy can enhance overall bone health, increase density, and potentially prevent osteoporosis from later on in life. So, we've mentioned this before on a podcast about how modernization kind of brings us away from the natural magnetic field of the earth, and we live in houses. We've got our shoes that are rubber. We've got cars that protect us from this natural magnetic fields. Doing regular PEMF therapy sessions every day is kind of effective, or even more effective as kind of living outside grounding that people are doing a lot of these days. But just a 10-minute session can have such a massive benefit on overall bone health. And that's just, 10 minutes each day.
Yeah, definitely. It's like exercising could obviously also help your bone density. It's a preventative kind of measure against that. But for people who have got osteoporosis, what kind of ways can they apply PEMF therapy for this?
So osteoporosis doesn't tend to be just localized to one area. Most often, a lot of the time, osteoporosis can affect the whole body, the whole bone kind of skeletal structure. So what you want to do really is treat the body, as a whole. And it's what we mentioned before a lot on the podcast is, if you have the budget for it, if you have the time to do it, then always invest in a full body system as a basic principle. If your full body system has a localized applicator, that's even better, because if you have specific osteoporosis in the knee or in the shoulder, then you want to intensify it in that area. And obviously, if you only have osteoporosis one area of the body, that could be the catalyst to more osteoporosis later on if you don't catch it. So, we would say, applying a PEMF therapy using a full body system if you can. And generally, we recommend going into the kind of higher levels of intensity when it comes to osteoporosis, because you want to have a nice big magnetic field, which is going to reach those areas of the body and go through the bone.
Okay, great. And for, say, someone gets a full body mat, how often are they going to expect to use this? Are they going to be using it every day, all day, or is it going to be once a week? How does it kind of vary?
Yeah, so for osteoporosis, really, it is a commitment. You want to be using your system every day if you can. Obviously, if you miss out days, it's not the end of the world. But if you can get a system that you can use for osteoporosis for 1 to 2 times a day, and if you could use that most days of the week, we're only talking about a 10, 20-minute session here. So it's not like dedicating a lot of time to these things. The overall benefits you're going to get from it and the results of that is just going to be outweigh the time and commitment you're going to put into one of these systems. We're also seeing the benefits of red light and PEMF therapy combined is really helping with osteoporosis and kind of accelerating those results. So, why not look into using a PEMF therapy and a red light system at the same time? You can do those at the same time, so you're not like adding on more time. But osteoporosis is something that is a bit of a commitment in terms of, you're not going to get results on a bone scan 1 week after using the system. We'd be looking at people doing these sessions on a monthly, and then looking at scans maybe once a year.
But if you do have any questions about PEMF and osteoporosis, make sure to leave them below wherever you're listening from. And if you're on audio platforms, make sure to leave us a 5-star review. It just helps us make more and better episodes and get better guests on every single week. And if you're on YouTube, make sure to subscribe. Our subscribers are going up quite nicely at the moment. So if we keep going, we can keep getting more and more guests.
Thanks for listening to another episode of the PEMF podcast.